Intraosseous access for the adult and pediatric clients is the same. It is used in emergency situations when IV access is unable to be obtained. Access sites for the adult and pediatric patients are also very similar. The proximal tibia, the distal tibia, and the proximal humerus are all used on the adult patient. The only exception with the pediatric client is with the proximal humerus. This can only be used if the landmarks are properly identified. Contraindications for intraosseous access for both patients include fractures of the bones to be used for access, inadequate landmarks due to excessive adipose tissue, infection at the landmark site for insertion, a previous IO access in the last 24 hours, and as obvious as it may sound, do not insert an IO catheter into any prosthesis. It is also important to note that the stylet and catheter are not MRI compatible. We will now demonstrate a proximal tibial insertion with the EZ-IO on a pediatric patient.
Corey Stubbs, and I'll be demonstrating the insertion of the EZ-IO, which is an interosseous needle system, and tonight we'll be demonstrating on an infant patient. But before we do that, I'd like to show you the equipment that's required for this type of technique. This is the EZ-IO driver, which is similar to a drill that you would find in your garage. This small pink needle is a pediatric interosseous needle. It's a 15 gauge needle. It's 15 millimeters in length and is used on patients that weigh over 3 kilograms or less than 39 kilograms. The blue needle is the adult needle for your average size adult, and it's used for patients that weigh over 40 kilograms. And then this very large interosseous needle is used for patients that have large adipose tissue or may be very muscular in build, and the standard adult needle will not work. This is also a 15 gauge needle, but is 45 millimeters in length. Some other items that you'll need in preparation will be a T extension set, which is similar to your IV lock, as well as a 10 cc pre-filled syringe. And then for your aseptic technique, you can either use alcohol wipes or chlorhexidine or betadine to swab the site before the insertion of the IO. Prior to insertion, we need to assemble our equipment. So we need to take our EZ-IO driver and attach the pediatric size needle. We then need to take our pre-filled syringe and flush our lock. Make sure that there is no air in the line. And now we're ready to determine the site that we're going to use. On the pediatric patient, we're going to find the patella, go 2 finger widths below the patella, and feel for the flat side of the bone. We're then going to take our alcohol or chlorhexidine and swab the site. Remove the protective sheath. And I don't know if you can see, there's a black line on this needle. When we insert it into the skin, we need to make sure that we can still see the black line prior to drilling. Come into our site at a 90-degree angle, insert, make sure that we can still see the black line, and then drill and slowly insert the needle. Remove the driver, remove our stylet, dispose of it in an approved sharps container, and attach our IV lock. We're then going to aspirate on our needle to see if we have any return of bone marrow, and after that we're going to flush the site to assure that there's no swelling or infiltration around the IO catheter. And this completes the insertion of the EZ-IO.
Hi, I'm Allison, and I'm going to show you how to take the IO catheter out. They always need to be taken out within 24 hours of insertion. All you need to take this out is a sterile Luraloc syringe and a gauze or some kind of dressing to hold pressure when you take it out. All you do is you take the Luraloc tip and you're going to hook it into the hub of the catheter. And while you take it out, you're going to pull straight back and turn it clockwise. You don't want to wobble it all from side to side because that could potentially disconnect the hub from the catheter that is in the patient's leg, or it could also break the needle that is in the bone. So just pull straight back and clockwise and then apply pressure.